have a few things written down here, and I'll throw them at you as quickly as I
Margie, talk
have.
into the microphone.
Will the Department of Health have more input this time, unlike the 2008 plan? Is one question, but in addition to that, since they were involved with it the last time, why didn't that plan work? Why should this one work? Right, Cynthia? Are you going to attempt, excuse me, to bring or to get more physicians, whether they be MDs, DOs, or whatever, to the area once you have decided that this is the plan that you're going with? Because it seems to me that we don't have enough qualified doctors, which is why people go elsewhere to get their services. Besides the fact that the Kingston Hospital emergency room, and unfortunately I've had another personal experience with them referring and transferring a patient to another facility elsewhere, and that just doesn't make any sense to me. Will the Kingston Hospital, assuming that is the one that you are closing, be sold publicly or only to another healthcare company? Excuse me. And one last question. What services will be provided at the newly named hospital? And since it's supposedly Benedictine, things like the maternity on the street, as Kevin said before, was that the maternity at the facility will no longer exist. Is that something that's for real, or is it just hearsay? Pediatrics has been removed from our community. Is that still going to stay gone, or will it be brought back? And since the new facility, even though it is this building and it will no longer be affiliated in any religious way, will that then be eligible, according to the DOH, to provide those abortion services? So therefore, Foxhall would be eliminated. I'm done.
Thank you, Margie. So for the rest of the evening, if you would just start answering Margie's questions, I'd appreciate it. There are several questions. I'll try to break them down in order. Will the DOH, the Department of Health, have more input now than they did in 2008 when the original plan was proposed and accepted?
I would expect that they will maintain a similar level of involvement.
Yeah, but I think we have to realize that the DOH, although they are a regulator and they have a responsibility to make certain decisions, they're making it within the context of the community, and they don't have all the answers either. They don't know what the evolution of healthcare is going to be. We all try to figure it out. We all work on it every single day, but every single day something about healthcare changes. And they made certain decisions and they gave us certain approvals the first time around. You're absolutely right. And there were very smart people here, as well as the DOH, who looked at our plan and said, it looks reasonable and it looks like it will work. But they didn't realize there was going to be a recession. Did anybody here predict that recession? Did anybody have any idea how intense and long-term and how much it was going to impact all of our lives? None of us knew that. But that's one of the things that we're all dealing with, and we deal with it in our daily lives, and we deal with it in the life of the hospital. And we will continue to do that. I constantly say that there is no coasting in healthcare. You never get to a point where you can relax and say, oh, we have the answers. We don't have the answers. We only try to stay ahead of the questions. And DOH is in exactly the same position. Not to mention the fact that we're all dealing with less money.
So I guess another way to put Margie's second question is, was the 2008 plan a failed plan from the beginning, or was it circumstantial, that things that happened that led to the point we're at today?
I would remind people to remember that hindsight is 20/20. It's very easy to sit back and say, yes, they didn't know what they were doing, nobody knew. We had huge savings from the initial consolidation of services. We've still benefiting from those savings. But again, reimbursements changed, the way that services are provided. maybe you don't want to talk about it, but we've all of a certain age. I mean, I'm looking around the audience. Okay, so how many people here have had a colonoscopy? And if you haven't, why haven't you? But if you had one 5 years ago, you may have had it at the hospital. If you have one tomorrow, it will probably be in your doctor's office. That's a huge difference in the way services are provided. Did we know that was going to change? It's not that it's worse. It's not worse for the patient. The physicians are now able to provide them in their offices or in their own facilities. They don't need to do them in the hospital, but the hospital that loses that revenue. So did we know that when we changed how we did things back in 2007? We couldn't have protected all those things. So was it a failure from the beginning? No, but things changed and we have to change with them. And that's what we're attempting to do.
The next question had to do with recruitment, one word.
Just one word about recruitment and the quality of our physicians. You know, David has already commented about the quality of our physicians. I think you want to remember that we are very, very fortunate in this area to have excellent primary care physicians, and we have more primary care physicians than most areas of the state. And so when you say we don't have good physicians and that's why people are going elsewhere, it's not because of the quality of our primary care physicians or the quality of the specialists that we have. Do we need other specialists? Do we need more specialists in certain areas? Absolutely. But everyone in the state is experiencing that same thing.
Is there a plan in place, Cynthia, to do more aggressive recruiting of physicians?
We are constantly recruiting physicians, constantly working with our own physicians to increase the services that they provide locally. It never stops.
The next question had to do with the fate of the Kingston Hospital facility.
We've been contacted by several developers with interest in, since we had indicated a preference for the Benedictine facility, we've been contacted by several different developers with interest of repurposing that facility for a variety of different services. So there is a
Healthcare related or?
Pardon?
Healthcare related?
Some related, some senior services, senior living facilities, senior medical services, and other types of community services that have indicators of being underserved. And so I think that's very encouraging. There's no commitments, there's no guarantees, but a very high level of interest.
Margie's next to last question concerned the services that are being discussed with the Department of Health. What services will be provided? And she asked, I thought was not that all of your questions weren't interesting, but this one was most interesting to me. Is there any prospect of any new services being offered as a result of the consolidation?
I wouldn't anticipate that there would be any, I mean, we're always looking. It gets back to what Cynthia said. We're working very closely with our medical staff. One of the clear messages going forward is that hospitals and physicians must work. It's always been the right thing to do. We must work very closely together. As we do that, we will and could identify other services that may be available. But at the current time, our interest is to preserve, work with our primary care physicians, work with our specialists to strengthen and stabilize the services that we can provide. And then as we do that and we look for alignment with other providers, there may be opportunities that could present themselves.
And I think this has already been stated publicly, but I'll restate the question as posed by Margie, and that is with Benedictine being chosen as likely being chosen as the singular campus, would that mean that abortions would be provided on the Benedictine campus?
It means that the campus that we use as a single site will have the ability to provide all levels of reproductive services, including terminations. I will tell you that currently there is no physician in this area doing terminations. But that doesn't mean that we could be in a position where terminations would never be done. We have to be able to have a full service facility in this community, and it will be the surviving entity. We've had that very open conversation from the very beginning. That's why it cannot be Catholic. We have to be able to provide current services and services in the future. We don't know what services may be restricted in the future, and we want to be sure that we can offer all services to the members of this community.
The next speaker is the king of all media, Clark Richters.
I'll pass.
He's passing. Okay. Dr. Paul Jankowitz.